No, Amanda, thank you for joining the podcast.
Thank you so much for having me.
We're excited to have you. I have a ton of questions. So we're going to probably touch on a lot today.
Okay,
I have a very interested in the world of acupuncture that you live in and some wellness. So I think we'll dive in and this will be fun. So ultimately, we're just going to kind of jump in. I don't think there's anything specific that we have to talk about, and just love to see kind of where the conversation goes.
Yeah, because like first of all, tell us a little about like what's your
You could
what's your
introduce
company
yourself here a
name,
bit.
a little bit about introduce yourself, where you're from, and then maybe your website. Let's do a little plug on that.
plug.
We'll do plugs.
Thank you so much for having me. This is amazing. I'm so grateful. So on my way here, I was like having such a proud moment because I was like, good job, Amanda, putting yourself out there.
This
You
is
know,
fun.
I may come off as being an extrovert, but I'm actually like such an introvert. So doing something like this
I think we can
made
all-
a safe space for me, guys.
I think we can
Thank
all
you.
relate to that a
right?
bit.
Yeah. So
Yeah.
thank you so much for making
Thank
me feel
you.
comfortable to put myself out there. Dr. Amanda Occhipinti. I'm an acupuncturist. I run my own healthcare clinic, Integrated Health Center. It's in Watchung, New Jersey. We just do acupuncture, different styles of acupuncture. I also do microneedling and cosmetic acupuncture. And then in addition to that, professionally, I do acupuncture for the New York Jets. So I'm part of their regen team, which is awesome. So much fun. And then I'm a mom of 2 boys, and we have 2 dogs too.
Boy, mom.
Boy, 100%.
Girl, dad, boy, mom,
I
boy,
got
and
both. I
girl.
got both.
No, God, no. Oh, this is like nice how
Yeah, we have
the
a-
seating
the balance
arrangement
as
worked.
well.
Yeah, it's like energetically.
See?
Right?
How about
Acupuncture's all
your
about
dogs?
balance.
The girl boy.
Yes, we have one of each.
Okay.
Yeah, we have one of
I have
each.
a boy dog.
So I have similar dogs to you guys. Before I want to get this out on the table.
Similar?
You have pit bulls. You have like a wolf, and I have 2 Maltipoos that are like this big. It's like your dog use a chew toy. So, but yeah, sorry for interrupting. So, what about a little bit about your business? Like, what's the name? Like, where you out of?
Integrated Health Center, and it's in Watchung, New Jersey.
Perfect.
So how does one come from Madison, New Jersey? Right? Well, you went to school in
Pretty
Madison.
much.
right?
I went to
New
Drew,
Jersey?
actually.
Went to Drew.
I went to
Okay,
college.
so right
I went to
here.
Drew. I'm technically from a town called Millington, which is right next to Basking Ridge.
I lived in Millington for a few years. I lived right on Rolling Hill.
I'm Shawnee Path. I don't know.
Oh, you're like a couple of streets away from
Yeah.
me. Yeah.
See?
Super
oh my
small world.
God. This
Yeah.
is shrinking
Yeah, it's
so
shrinking.
much.
It's shrinking. So, so how do you come from? Is it considered like Chinese medicine? Like, what's the
Technically. Traditional Chinese
traditional
medicine.
Chinese
Yeah.
medicine?
Yeah, that was
So
one of my questions too. What's
Yeah.
what's it?
how do we go from New Jersey, born and raised? I'm guessing.
Yeah, for sure.
to-
It actually doesn't get more Jersey than yours truly right here.
Yes, there you go.
So-
You're in good
Good,
competition.
right. I shouldn't say that. Maybe, you know.
We'll talk about that.
Yes.
So how do you get into that? Like, what turns that knob?
So I come from a family where my grandfather was a chiropractor. My dad's a chiropractic doctor. So like before it was popular or tasty, we had like gluten-free pretzels in the house and like rice pasta because we knew about inflammation. And like, it was like, no, take vitamin C. If you really need the antibiotic, then we'll go to the doctor. Like, so it was always like, let your body heal first. So I was exposed to that concept at a very young age. And as I was growing up, I remember thinking like, okay, I want to own like a health center one day because I was an athlete. I love exercise, healthy family, you know, all that kind of stuff. So, but then you get to be like 18 and they're like, what do you want to do with your life? I'm like, I don't know, I'm just going to work for my dad.
Yeah.
So I went to Drew University and graduated with a degree in behavioral science because I liked medicine, but I was interested more in the mind concept, but I knew I didn't want to be a therapist. So again, I was like, I guess I'll just go work for my dad and become a chiropractor, join the family business because why not?
Just cracking
Yeah.
necks.
And I applied to chiropractic school, got into chiropractic school, and so my term was supposed to start in September of 2011. No, that's wrong. September
You don't have to
How
date
old am
yourself.
I on?
just-
Anyway,
just roll.
September. It was supposed to start in September. And that previous December, I was in an automobile accident on Route 1, 4-car pileup, and it brought back all of these symptoms that I had as a child after having a traumatic brain injury. So my father suggested, listen, why don't you build a case, use your car insurance, go see my friend he's a chiropractor, but he also does acupuncture. I was like, okay, Dad, sure. So went over, saw him, and I always had gotten relief as a child as a chiropractic patient. And then one day the doctor was like, do you want to try acupuncture? Like, sure, why not? Can't hurt. And I will always remember this experience because I had an outer body experience. I'm laying on I can see it. I'm laying on the table. He's putting the needles in, and then all of a sudden, this energy in my body just started like swirling around as if like, I don't know, I was being exercised or something. But I just remember feeling this unbelievable sense of calm and this state of balance that I had never experienced before in my life. I mentioned the doctor because of some of the symptoms from my traumatic brain injury came back, like headaches, brain fog, lack of concentration, personality, depression. They went away.
In one treatment?
No.
Oh, like how
No,
like I was in a couple treatments?
Yeah, but I got relief from migraines that I had never gotten before from just, I don't know, and I'm not putting down chiropractic, but the combination was just so life-changing for me. And so I spoke to the chiropractor. I was like, hey, I love acupuncture. He was like, well, if you do, consider going to get your acupuncture degree first, because it's less time and less money. And then if you still want to do chiropractic, you can teach, you can practice, offset some of the costs of chiropractic school because it's very expensive. I was like, oh, okay, that works. So I applied, got into acupuncture school, started, and I knew that that was it.
So I've had acupuncture twice. I remember a similar feeling, right? Like it was the weirdest thing for me. Like I had hurt my neck. My
sorry.
back was jacked. I was like, I got to try something. I went to this place and they had, chiropractors there, physical therapy and acupuncture, and they literally cycled me through it. And I was like a naysayer kind of I can understand where there's benefit, but I was legit hurt. And I'm like, yeah, this probably isn't going to do much.
Sure.
And, laid down on the table and the acupuncturist came in and she was looking at me, talking to me. And she came over and she's like, open your mouth. And
yes.
she was like,
She checked her tongue.
yes. And I was like,
Uh-oh.
all right, this is.
I'm out. Get me out of here. Where's the exit?
What's the tongue thing? What does that mean?
In traditional Chinese medicine, that's one of the ways we diagnose is by looking at the tongue because it shows the internal health or the disease that's within the body.
Oh, really?
Yeah, she was like, do you have acid reflux? And I was like, yeah, all the time. She's like, oh, okay. I was like, all right, this is
Sure, any patient of mine is watching this, they know exactly what you're experiencing.
this is my first time. Okay, this is So
Well, you're not used to it, and that's
And meanwhile, I'm totally still. I'm like, yeah, okay.
Right,
So
fix my neck.
So it lays me down, starts throwing in little needles everywhere, and to be clear, it doesn't hurt at all. You barely know this is happening. I just felt like I was getting hot and a little dizzy and not in a bad way though. It was strange. So, she kept checking on me. Hey, do you need some water? Are you okay? I was like, yeah, no, I'm fine. But she probably saw something going on. And I remember we were done and I sat up and I was like, well, way too fast.
Yeah.
I was sat up way too fast. I was like, I'm going to need a minute. She's like, just take your time because she's like, there's a chance you're really dizzy. I remember being a little dizzy, a little bit nauseous, but the feeling of it was just something I've never felt before. definitely like always thought like, okay, I need to go back. Like it's like in always in your head, like you got to go back and get more. But it worked. Like I struggled with like my back and like it was really like I don't know if I had got like whiplash from something. Like it was a stiff neck, felt like a stiff neck, but like it was probably like 2 months before I actually like, it was like would get a little better, then get worse. And I just couldn't break, like I couldn't sleep to one side.
Right.
So within like 2 treatments, like I felt like $1 million.
Yay.
So it kind of made me a believer in it. That's why when Gabe had suggested that we kind of do this, I was like, yes, we need to do this.
Because just so you know, the premise of this is little business and then the health and wellness, because that's a lot what we talk about
Yeah.
all the time.
Where does like cupping fall into this, and how does all of that tie in? Because that's
Cupping
part of
is
it, right?
totally like from traditional Chinese medicine.
Yeah.
We started it.
Yeah.
And now it's just branched off into other professions utilizing it, which I'm all for that, as long as everybody's being safe with adequate training.
Right.
Because people are like, oh, I bought this at-home cupping kit. And it's like, okay, but like you want to be safe and you want to be trained in how you're applying. It's a therapy.
I've seen some
I
like
feel like
pretty
every
extreme.
college athlete is walking around
With cups.
Bruised
Yes.
up.
everywhere. Like I know that the trainers, like I work at Seton Hall University.
Yeah.
I'm sure that they're trained, but I feel like every one of the swimmers and divers and they're big into that.
What's the kind of science behind it? Like what
Cupping?
Well, acupuncture and cupping. Like starting with acupuncture. Like what's the science behind it?
So with acupuncture, from like if we're going to just use like more Western medicine terms,
Sure.
every time a needle is inserted into your body, it starts the inflammatory cascade, which drives more white blood cells, red blood cells, plasma, nutrients to the area, histamine, to facilitate healing. So it's just activating your body's most amazing thing it does, and that's heal itself. There's nothing in the needle. It's just utilizing that. People, when they say like, oh, I'm a believer, it's like, that's great. And I don't want to shut down that idea of what acupuncture is. But if you get a paper cut, you don't even believe your body's going to heal the paper cut.
Right. So that's what
heals a paper
essentially it's
cut,
doing.
yeah.
It's triggering
It's
the immune
facilitating
response.
the healing process. Now, with acupuncture, there are 371 specific acupuncture points that are along, we call them meridians. These are pathways in the body. These specific points have actions and indications. So they're used for very specific things. So
Now,
that's
what's
where
the
we
system?
put.
So is that
Sorry
why
to ask you
like
so many questions.
She asked you about your digestion.
Well, yeah, or like something on like your calf affects your
Yeah,
neck.
exactly.
Right? Like,
yeah.
Is that the idea behind it?
And the way that they developed that is just, they trial and error. They were able to map out this meridian system. And they did it without ever doing
Having-
surgery.
sure.
This was just without ever looking within the body. And if you look at the meridian system and you compare it to what we know as the nervous system, there's a lot of overlap. So they were definitely onto something.
Right.
So in addition to having those specific points on the meridians, you also have points on the body that are extra points. So they're not on a meridian, they don't have that connection, but we know that it does this. So that's
sense.
where, as an acupuncturist, it's not just like throwing darts. Like, oh, here, let's go today. There's really like a recipe, if you will, to
Like
it.
her whole Instagram's like, it's like stiff neck.
Yes.
Please don't yell at me for
No,
saying the
no,
wrong
no,
thing.
it's
like
okay. Yes,
two
yes.
fingers under your knee, just push right there. Feels better, doesn't it? So
I would like to really talk. I'd like to circle back to that. Just with the cupping. Cupping is a little. So if we're talking about it from TCM, or if we're talking about it in terms of my application of the cupping, if you come to me and you have something called blood stagnation,
What's
which
TCM?
Traditional Chinese medicine.
Got it.
If you come to me and you have a sharp stabbing pain or pain that's at nighttime, all these things can indicate that you have potentially something called blood stagnation. And one of the ways we move the blood stagnation is with the cups. That's why you get the marks.
Is that why TikTok's great for this? You see actually people cup and it's fills with blood essentially.
Yeah, that's what's happening.
Okay.
The stuck blood in the muscle is coming to the surface so that new blood
Can move in.
get moved there. So people conceptualize in terms of Western medicine, cupping like PRP, but you're not just getting plasma, you're also getting red blood cells and white blood cells.
Got it.
Which is also why you can cup and still get a benefit because you're still getting relief of the fascia because of that negative
Yep.
pressure that comes with the cup, but it's not a muscle or blood stagnation issue. It's more fascial, or it's
Yeah. Is there
Different
like,
application.
How do you differentiate? Like, okay, we should use cupping here. We should use acupuncture.
so like when you come to the office, we do an intake, we do an exam, we ask questions based on your examination, based on what your tongue looks, your pulse feels like. I'm not an acupuncturist who uses pulse and tongue as my diagnostic. I'm trained. They teach you it because that's
yeah.
the basic of what it is, but that's not what I utilize. But based on that information that we gather from your intake and your examination, that's how we know how to dictate your treatment. And then sometimes patients are laying on the table, and based on them, how they respond to the treatment. That's at least how I work. Everybody,
Yeah.
it's like hairstylists. It's like, I don't know, anybody in their profession is going to have their own flair
Yeah,
to
of
it.
So like, what are some of the questions, we were all athletes, and like, I'm sure lower back pain,
Yeah.
shoulder pain, him and I talk about shoulder pain, probably like we're like two 85-year-old men a lot of times. Like when you like examine them, like let's say again, lower back pain, like what's that like? What is your like
What do
process for that? For like when you were asking to decide, are we going to do cupping? Are we
Cupping.
going to do?
So I do an orthopedic exam just because that does give you information into some of the tissues that
Yeah.
could be involved. And then in addition to that, how your description, who else you've seen, what other treatments you've done, what's working for you, what's not working for you. I also do incorporate something called applied kinesiology into my office, which is muscle testing. So it's essentially, I have these muscle testing kits that lay on the body when the patient's laying down, and I touch the different acupuncture reflexes, and based on the response you get from the body, that's how we also know how to dictate treatment. So there are a couple different. So it's just for lower back pain, we'll examine your lower back, but then I'm also going to ask you about your sleep. I'm also going to ask you about digestion because, again, the way I approach healing, because we're looking to heal the body, not just put a Band-Aid over it, is you have to correct digestion first. Because if you're not digesting, eliminating the toxins, absorbing, feeding your cells, how can your body heal? So after you work on digestion, then you have to work on sleep, because as you guys know, when you sleep, that's when your body restores. That's when it regenerates. If you're not sleeping, how can your body heal? And then
that
you
was my
look at
next- I wanted
things
to talk
like
about sleep, too.
fatigue, and then you look at hormones, and then you look at energy. And once you have kind of all those in balance,
Yeah.
yeah, sure, we can put a needle in your lower back pain. Your lower back pain is going to go away because you're in balance. You're ready to receive the treatment.
If you had to like, what is the coming to your practice? Like, what are most people coming and
For?
like, just like they walk in the door and they say, this is, is it usually some sort of ailment, pain,
Yeah,
something
and I
like
think
that?
because of my affiliation with the Jets, a lot of people, and my background as an athlete, working for my father who does a lot of sports, I think that that's a draw for me. But I also treat a lot of mental health, a lot of headaches, digestion. I think that just my practice is people who want to integrate something into their wellness routine, because that's a big part of what acupuncture do. Like, you can totally come, like, fix your lower back pain and then let me know if you ever need it for your neck or your shoulder or your big toe. Arthritis has become very popular lately too. So
Is it a lot of like, just like you said, people are putting it into their wellness routine, so they're coming once a month, coming, a couple times, once a week. Like, what do you like? Do you typically recommend like a maintenance of it?
it depends on. Yeah, well, yes, because I'm like that. I mean, I do lots of things for maintenance.
Right.
So I think I'm biased in that way. I mean, I want to meet people where they are if they're not interested in that, but because I'm a wellness patient, I'm going to promote wellness.
But it makes sense from a like science standpoint.
Yeah, and some people don't agree with that. There's in the acupuncture community, and it's probably like this in every
everybody's got
profession.
opinions, yes.
Everyone's got opinion. This is just mine.
Yeah. How do the like pro athletes utilize it? Like, if you're talking, taking
So like with the Jets, are you doing
one
a
of
lot
the
of
one of the
cupping?
guys from the Jets? Like,
Yeah,
what's
so
their
there are a few different ways that it works when I'm at that facility. The first one is they just sign up for weekly treatments because we're there once a week or twice a week. So you come for that tune-up.
yeah.
Like, do it all.
Yeah, yeah.
Put a needle everywhere. You
Yeah.
know, like I'm just tight and I just want that nervous system relaxation or just everything kind of hurts. So you address the wellness. And then you have other players who will come because the trainer said, hey, Amanda, we want you to work on X, Y, or Z. So you come and you work on X, Y, or Z. And
So
then,
the trainers will actually like recommend them. They'll
Yeah.
be like, hey, we've done this, this, and
yes,
this.
go get acupuncture.
Go get acupuncture.
So that's another way. And then sometimes it's just on the fly, like, oh, my shoulders feels a little too.
I think
so
you're
let me
getting
go
two new
get-
clients after this. By the way.
But back to your point before when you were talking about
Yeah.
so during COVID, everything shut down. And I mean, I love acupuncture so much. Like it's a part of that's how, like when we were talking and it's like, even the way we're sitting or our connection, like that's happened to me. Like the law of attraction, synergy, it all just started to flow as I became an acupuncture patient. So part of that, losing that during COVID was awful because I couldn't help people.
The connection of it. Yeah.
You know, and I couldn't do something not only that I love, but I couldn't help people. And we were all, oh my God, what a terrible, like,
Yeah. That was,
it was
a rough,
hard for so many reasons, right? So I went on TikTok and I saw an acupuncturist on there and I was like, oh, I didn't think about that. And so I started to just tell my, in acupuncture school, I had this quote that we would throw around. Oh, there's a point for that. Like you got,
Yeah.
name it. No, there's a point for that. You know, we
Yeah.
would just say that to each other. So I was like, oh, that's it.
That's a
I'm
good
just going to
one.
utilize that saying that we would throw around for fun in school. And I started, it was really, and it still is, the premise behind my social media is just education. Like, yes, acupuncture can treat something that you're going through. And then you'll get people who'll come and like, oh, I pushed here and my headache went away or it didn't work. This is BS. And it's like, okay, well, it can work that way. But that's, again, what we had mentioned before. It's the using that point there and that point there and that point there and that point. And that's what's going to help your
Right.
neck pain, back pain, whatever it is.
No, that's I think trying to put out like, providing value through social media is really what it's meant for. The problem is social media itself.
Yeah.
But I think anybody who has the ability to bring value through social media like that's what wins, right? That's what works. It's genuine. It's, hey, this is what we've seen work. This is what can work. Not everything works for everybody in every industry. It doesn't matter.
Right,
So-
right. Or that's why when people are like, oh, I tried acupuncture and it didn't work. I'm like, okay, I wouldn't expect it to work for everybody. You
Yeah.
ever take an Advil and you still have a headache?
Yeah.
So I did chiropractic for forever. One of my really good friends, a chiropractor, went to him forever. And I tried, I don't know if you've heard about PRI, Posture Restoration Institute. They're out of like Ohio, which
No.
you definitely got to look into.
Yeah, no, I will.
So my friend was in tech and doing very well. He decided, and he's literally has very similar social media content as you, Neil Hallinan, which I'll send you the link.
Yeah,
for.
I wanna see.
Maybe we'll put it on here. But it's like a little mini exercises to get your spine, pelvis,
Love it.
shoulders into alignment. And like, it's a bunch of different series of things. The first time I did it, I'm like, what are you doing to me? And like, you guys had the outer body experience. So I was in 9 out of 10 lower back pain issue from,
Yeah.
being a linebacker, doing all the stupid, CrossFit stuff for years, destroying my body. And I did that I did literally one session with him for an hour and a half. And I'm like I felt like heat just go through my entire legs.
Wow.
And I'm like, wow. And he's like, you're going to feel weird, but like, this is the first time your pelvis and I actually could breathe again.
Isn't that amazing?
And it's so, you guys got to check that out because that's a whole nother thing, the PRI stuff. But, again, her Instagram has a lot like that. I love the education end of that. Like, that's what it should be there for, instead of teaching our kids, all the stuff that my 9-year-old son knows now that he shouldn't know.
Everybody becomes a professional at everything now.
So, yeah.
So that like all that at home stuff now, that because there are so many people teaching,
Yeah, right.
You start seeing, you could go on Amazon and buy anything.
Anything.
So where have you seen bad failures with that?
That's a good question, too.
Oh, like I
Like somebody
started
comes
throwing up or something like that when I
somebody comes
pushed
in
here.
and they're just like bruised head to toe. They're like, oh, I bought cups. And now they're like,
So less with cupping, but a lot with the Theragun. I have seen broken ribs.
Really?
I have seen punctured organs with
Really?
older populations misusing the
violent.
the
put that
Theragun
on a
like
bone, it hurts.
really out of
It really
everything is in my experience seeing injury from self-treating Theragun.
really?
Yeah. So I tell people like, "Oh, I have one of these. Should I use it at home?" I'm like, "I'll do it when you're here, you know,
Yeah.
because you really could injure the tissue beyond the point of like, not just want to say repair because it's not beyond the point of repair, but beyond now your ability to self-care for it."
Right. It's like a literal like trauma. to
Yeah.
the-
Also, cupping is different, I think, because like a lot of people like to cup their back, and if you don't
Yeah.
have somebody applying the cups for you,
yeah.
you're less likely to do it versus like, you know, sometimes like the thighs, I guess you could
They
do
don't
a
have
little
like
bit.
self like needling.
No,
stuff,
no,
right?
no.
That's-
Needles are like a
that's-
medical device. You need a
You
license to
need a
buy
license to buy
them.
them, okay,
I mean,
good.
maybe they sell
'Cause
them
that
on
scares me a little
Amazon,
bit.
but
And they sell a lot of stuff online.
I want to say I saw somebody posting that you can buy needles on
I'm sure you can, but like
Amazon, but
somebody's got to know where to put them.
right. And also, I think because it's a needle, people like. I love acupuncture, but don't love needles. I mean, I had 2 children and chose not to have epidurals with either one of them, not because of any
'Cause of
other
the-
reason, but the idea of getting a needle in my spine. It's like, no, I'll take the pain, literally. And I get my blood drawn, and they're like, I'm looking away. I'm like, oh, what do you do?
Yeah.
I'm like, I do acupuncture. I'm like, what? I'm like, it's different. We restore the life in people. You're taking it away, you know?
My wife hates needles.
Yeah, it's understandable.
I have zero, but like I don't care.
Yeah.
That's the one thing that like I've been on TRT for like 2 years now, and you know I have to stick myself like once a
Right.
week. I've just become so numb to it.
Yeah, I mean, in the beginning, trying to give myself treatments, I'd be like following my hand like this. Like, it's a weird thing to do
It
because
is a
your brain
weird
is
thing
like,
to
oh,
do.
I know that this might inflict pain. Why would I want to do this? Not that it's painful, like you had said, but it's a sharp object approaching your flesh. So your brain is sending you this message like, this is not okay.
That's not
like,
okay.
stay away,
Yeah.
right?
So that's
So you
like a
get
big myth too, like
desensitive.
with the pain. Sorry to interrupt.
No,
you, but
no,
like
it's okay.
when you're saying with the pain, that's like a huge thing. Why I've never gotten acupuncture, and then after you're hearing your story about this, like I think you got a new patient here. So like can you debunk that myth
Yeah,
for us?
no.
Like, so
This is what I tell people. Like, if you were a new patient and you were coming to my office, we would go through the exam, and right before the treatment part, what I would say to you is,
Gabe, you're a 260-pound pussy. Stop for little needles.
No. Acupuncture is designed to help, not hurt. Heal, not hurt. However, we use needles, so sometimes you may feel them.
You guys do
If-
it like that little like tap,
Yeah,
the little
that's it.
tap thing.
If
It's
you
so-
feel anything sharp and burning beyond a little prick, let me know. Because all that means is that the needle tip is touching a hair follicle and it needs to be taken out. So you are, and I tell people that who are a little apprehensive, I want the patients to know like they're totally in control. Like, you don't have to muscle through anything. Like, let me know. I want this to be comfortable because if you're not comfortable, it's going to affect your ability to receive the treatment. The one, I don't want to say like excuse for that spiel is if I'm doing, it's called trigger point acupuncture, but some people call it dry needling. Dry needling is a technique that you can feel more because we're causing a fasciculation or a trigger within the muscle, and you can feel that and you can experience post-treatment soreness from that. You can get sore from regular acupuncture, but that technique specifically, the likelihood that you could get sore is higher. And again, I try to explain. And I can tell people this till I feel like I'm blue in the face and they'll still come back and be like, I was so sorry.
So what is dry needling? That was the difference there.
Okay, so dry needling is a term and a technique that was developed. It's trigger point acupuncture.
Okay.
It's trigger point acupuncture. But in the 1970s, a medical doctor took a hypodermic needle, so a needle you would get a shot with, and inserted it into his patient's Achilles tendon because they were having pain. And the pain went away. So because there was nothing in the hypodermic needle, he called it dry needling because he wasn't using an acupuncture point. Now what has happened is non-acupuncturists, because now it's all changing, but in New Jersey up until a few years ago, if you weren't an acupuncturist, you couldn't needle. You needed an acupuncture degree. But then the PTs were like, that's not fair. We should be able to needle because it's not acupuncture, it's dry needling. It's acupuncture. You buy the same needles. Okay, you're not using acupuncture points, but it's a technique that was developed by acupuncture thousands of years ago.
To essentially bring blood to that
It's
area.
just if you've got a sore spot. Like, because sometimes we need to needle into a sore spot for pain.
Isn't there a technique too, and I've never seen it, so I could be totally wrong, where you include stim with?
Mm-hmm.
Okay.
Yeah, so that was the other part where, again, if I'm applying electric acupuncture to a patient, it's extremely important that you emphasize this should not be painful. You should only feel a pulse. If it is, we're not in the right spot.
Right. Yeah, because I mean,
But that's, again, this is how I practice. Some people, they're like, no, you need to get them to feel it.
Yeah.
I don't know.
This is
when
just
I had
my
it,
approach
I
to it.
like didn't feel it
Yeah,
at all.
yeah,
Like
yeah,
you
yeah.
feel the tap of
The little
but,
putting
yeah,
it in, you know?
Yeah, it wasn't anything like that I thought was significant.
So-
but Gabe, on the other hand, he might be a
Right,
little soft.
and everybody's
So-
nervous
I will
system
cry.
is different,
I
and
need
you
a
would just
lollipop.
have to. Sometimes you pin the nail on the point, you know,
Yeah.
like the first time, and sometimes you don't. That's why they call it a practice, right?
Yeah.
But so ironically, we were supposed to do this podcast like a month ago, but I had to reschedule because I landed in the ER. And I was having tachycardia as my primary symptom. And I went to a medical doctor and they ruled out, I have a tremendous amount of cardiac history in my family. So I have a cardiologist that I just, monitor my cardiac health. So I went back to the cardiologist after this episode of landing in the ER, and they were like, well, we know it's not this, and we know it's not this, and we know it's not this. So, okay.
They didn't tell you what it was, though?
No, because that's and I
So just a fast-
absolutely think that there's a place for Western medicine.
Yeah.
I really do. I'm not all. I mean, I'm all in Eastern medicine, but there is a place. If your arm is falling, your bone is popping out of your socket, like go get surgery.
Yeah.
There's a place for the technology that we have now. But and this is not every Western medical provider, but most of them are not interested in the root cause. They just are interested in ruling out, we know it's not this. But I was still feeling horrible and symptomatic.
Just
So
like a high heart rate, just like
That was
heart
my
racing.
primary symptom.
Yeah.
That was my primary symptom, where I would be just sitting in this chair and doing nothing, and my heart rate would spike to 155.
I had a similar
Oh.
That's scary, situation, and the only thing I had a few drinks. I wasn't wasted. I was pretty okay, but I had a few drinks
Yeah.
like the night before. I woke up like 3-4 o'clock in the morning, and I felt like my heart was going to jump out of my chest.
Yeah.
Like within like a few minutes, I was wearing my Garmin watch, and it like will give you that like, hey, high heart rate detected, like all freaking day long, and I'm like, I felt it, and I was like, what the hell's going on, right?
Yeah.
And like you can do all your
Ugh.
EKGs
Oh my
and all that
gosh.
fun stuff. Like
Yeah.
I was freaking out.
Yeah, same.
Like, and it took like a day and a half, 2 days for it to like I was like, I'm having like a panic. Like I'm
Right,
like,
no, that's what they're
I'm
like,
a pretty
oh, it's
freaking stable
anxiety.
individual,
Right,
For the most
right.
part, like I
Yeah.
deal with a lot of shit all day.
Right.
I was not like I didn't feel that I was there.
Yeah.
But yeah, it scared the shit out of me. Like I was like,
so sorry.
I was literally like, what? How does this like? Am I having a heart attack? Like, is something really wrong?
Right.
Like, what the hell's going on?
Right,
So
right.
I could fully relate to that. Like,
It's
that-
not life threatening. So just, and they didn't want to like, put on a medication because they're like, there's
Yeah.
nothing really you can do. Oh, we think you have preventricular contractions, which can set the stage for these types of things. Okay. But I was still symptomatic. So I was like, oh, right. I should just give myself some acupuncture. So I did 2 consecutive days of treatments, asymptomatic.
Do you do it yourself?
At that point, I did because I was like, I needed acute care.
Yeah.
And putting the needles in the lower part of my body, I start with first, because to use my hands, I have to do all the other points before I do anything in my hands. And I like immediately put the needle in. I was like, right, this is why I do what I do. I mean, the relief my nervous system experienced was just awesome.
I'm finding myself like getting very deep down the rabbit hole of like the preventative, more, wellness style of medicine, right? Like, I think that's really where our world, especially our country, needs to start gearing towards versus, there's a lot of doctors out there that are like really starting to push this right now, right? This like medicine 3.0 idea, like, the Gary Breckas of the world and like, right. And so following some of that, like all of this kind of starts tying in, right? Like just getting in front of it, understanding the root cause of things and like how we got here. Before I started TRT, like I was on the verge of being a diabetic, like literally, and I've always worked out.
Yeah,
I've always gone to
you're
the
in incredible
gym.
shape.
It runs in my family to an
Don't give
extent.
an ego.
So it was just one of those things. I'm like, something's got to be up here, right? Yes, I sit in an office mostly all day, right? But like, I've always kept active.
Yeah.
Like, I was never really looked at myself as like out of shape, and like literally, my diet was always decent, but my gut health sucked. My sleep sucked. Like there was just so much around it. So looking at it, I was like, okay, well, let's go. Found like a wellness doctor, and we just started talking about things. We were like, he did all my blood work and worked it up, and like all over the place. And testosterone in like the high 2s, low 3s, and he's like, your free testosterone was super low. I'm like, he's like, you're feeling this now. We can try to, it's probably, vitamin D's low. So like all these things start like correlating back, right? So we tried, getting my vitamin D up and doing that, and then wait a few months and see if things start to come up. And ultimately I just decided like, after trying a few different things and getting it up naturally, I was like, let's just get on something.
I'm a huge actually supporter for
I'm very open about it because I say it all the time.
Especially when you need it. Yes, you have to address all the other things that could be contributing, but you have a genetic predisposition to something.
Yeah.
Give your body the support.
And I would assume that being a diabetic is probably not a good idea.
No, right.
So if I could avoid it, like avoid insulin, avoid going down that road, right? It makes sense. So similarly, like trying to find Eastern medicines that do help with somebody who is symptomatic, right? Who is feeling something great. That really should be everybody's like first go-to. The problem is we immediately are trained by everything around us to go to drugs.
Well, it's an instant gratification too. Sometimes you need to come to me for 10 treatments before you get results. I'm an athlete. I want you better leaving than you were coming day one. But some people's nervous systems are so dysregulated that you have to restore that first before they can be accepting to any type of. I have people who come to me who are on so many meds.
Yeah.
And our step one is sometimes just getting those working.
Yeah.
And this is a drug that's designed to be so aggressive. It's not natural. It has a natural derivative, but it's not natural, so.
Yeah, no, and I think you even hear like people that are taking like blood pressure meds, right? Like the way that bodies react to those, like it's bring your blood pressure down, but like you could barely walk now, right? Like you see like their muscles and like everything gets hard. Like there's our cholesterol medicines of maybe I'm talking about, but like there's certain things that like really affect.
Well, that's a genetic issue. So people who have that rheumatoid arthritic or myalgia symptom from a cholesterol medication, it's because they lack this this enzyme that changes how their body processes the medication and then elicits that side effect.
Right.
Which there's not You have some doctors who are interested in testing your pharmacogenomics
Yeah.
before they put you on medication, but most of it's just trial and error.
Which, like, probably doesn't need to be the case either, right?
Again, but then you have a case like my father who, like, because of his genetics, needs to be on blood pressure medication. He tried to manage it for years
Yeah,
naturally.
of course.
Yeah, some people
Years.
need-
But that's what it's there
Years.
for,
Yeah.
right?
Right, it's there for that. And we
That's
have to
what
be
it's
so
there for.
grateful that it's there for
Right.
that. But then supplementing that with, again, your body's most remarkable ability to heal itself. Like, that's what our bodies do every day.
Yeah.
We're not even aware of it happening.
Yeah.
I was supposed to get shoulder surgery, a year ago? A month ago?
Yeah, I
right?
talked him out of it.
He talked me out of it. And I started, like, doing some, like, exercises and, like, I'm very happy I didn't get the surgery.
Yeah.
Like, I probably will eventually need it, is the reality.
Sure.
But,
But,
like-
it's there for when you do.
But it's there for when I do. But, like, I would probably still be laid up for the next 6 months trying to, like, recover from
You would be so mad right now.
Yeah, very mad. But ultimately, like, I heard it it's been hurt for a while, but, like, I thought I was 12 and did a Tough Mudder or, like, a Spartan race.
Oh, God. God bless you.
was
Oh,
like,
my goodness.
You know, you were, like, running
good
against,
picture
That
for
was so
Instagram at the
intense.
end.
I was, like, running against, like, 25-year-olds that, you know, no shirt on, the dudes just
Even
jacked.
that
It's like,
aside, it's
this
like,
isn't happening.
oh, those are crazy.
It was intense. I did the short one, but I made it through it. I was
Don't
happy.
downplay. That's
But,
aggressive.
My wife
I
and
didn't-
son did the one at City Field this summer.
Yeah, I did the one at.
Oh my
My
gosh.
son won
Mountain
it. He
Creek.
has the big medal.
I didn't come out
Crazy.
unscathed though, so I was like,
Bravo.
I was pretty hurt, and it took like a couple months, and like I felt it slowly getting better, but like I was basically
Yeah.
nursing it, stretching it,
Yeah.
stim, just trying everything, but it like eventually got better, right? And
You give it the opportunity to, though.
right, I gave it the opportunity. I mean, the doctors were like, "Let's get you into surgery," and I'm
Right.
like, "Let's pump the brakes
Well,
here."
that's
Yeah.
exactly what I said. I was like, I feel like everyone's just like up surgery right away, like for all that stuff. Like you said, like let it heal a little bit, try and do.
I mean, if it was hanging off and you don't have a choice,
Right,
yes,
right.
sure.
And there are times where it's a fine line and it could go either way. My husband broke his foot over the summer and went to the surgeon, and he looked at it and he was like, we could give you surgery. We could, or you could just let your body heal it. And he's so happy he did that.
yeah.
Because there's always a risk, right? Like you put parts in or you tighten up here, or, you know, loosen there. And then what kind of cascade does that have on the body? So there's, again, with anything, there's a risk. Even with acupuncture, there's a risk. You know, they're minimal, but anything. You get in your car and you're taking a risk.
Yeah. Do you have any memorable cases that you've like?
So I have one case where this is how I learned that I'm a very empathetic to a fault practitioner, and I have to have like better boundaries and like grounding rituals, I guess you could say, for myself, because I was so when you go to acupuncture school, you have to do, it's kind of like a residency. You have to do a whole year of being in a clinic. You need 3,000 hours. Yeah, it's
wow.
it's like 3.5-year program, college degrees required in the state of New Jersey. I have my doctorate in acupuncture, but you graduate with a master's. I just went on and got more education, so to have that title was important to me. So anyway, I did my residency or my clinic rotation at the VA hospital in South Orange?
Bedminster?
No, the South. I think it's South Orange.
Is there one
Or
of them?
Orange.
Orange,
One of the
yeah, there's
orange,
in
one of the
yeah.
oranges.
Oranges.
And there was this gentleman that came in, and he had he had a hernia, and so they put a mesh in to repair the hernia. But because of the mesh, he couldn't walk. And I'm laughing. I'll get to the point of why I'm laughing, not because of that. But I started to develop growing pain working on this case because I was just so invested in. But he's one of those amazing cases where he was able to walk.
Wow.
After one session getting acupuncture. He couldn't, I mean, this gentleman had so much pain, he couldn't weight bear at all. And after one session, he could walk. It was
pretty
amazing.
nice.
So for
Yeah,
two,
that's
that's why I'm like,
Yeah.
that's a special case for me, because I always remember, like, I had so many learning moments.
Yeah.
So many learning moments.
That's cool. No, I mean, I'm sure you see stuff all the time that like, you know, people just start like getting mobility back,
Yeah,
or
yeah,
right,
it's
like
really exciting.
like just like in normal course of you see progress, especially people that come frequently, or that's why they're coming back,
Yeah.
right?
Yeah.
Now, I
mean-
got a question about the. Yeah, you said something about sleep before. I know that's been a
Yes.
rabbit hole that I've been going down a lot lately, as far as like, So, what type of stuff do you guys offer for like sleep issues? Like, again, how does the Western world treat like sleep apnea? Like, they don't have, not the Western world, the East, excuse me, Eastern medicine.
So
Excuse me.
we want to examine, how's the functioning of your heart. We want to examine how's the functioning of the liver. We want to examine, because the liver is very important for your sleep. But I say these terms and people are like, do I need to get my liver checked? It's like, no. I mean, sometimes there's overlap, but we're talking about, we're in a totally different world. But what I think is kind of cool when you're talking about sleep and just anything in general is the associations that come. So you talk to people about like their emotional health, and it's like, well, what are you angry about? What do you have resentment towards? Are you being too kind to somebody else and not kind enough to yourself? And like, I don't ask for answers, but just like thinking about those things, and that emotional hang up can cause a lot of disturbances in the body, which will bring me to, so another thing that I experienced as a patient in the beginning of getting acupuncture is I would feel like crap after some of my sessions. Like, I felt great after the first time, but once I was in acupuncture school and really getting like regular treatments, working on all different things, oh my God, I would come home and I'd be like, I don't know if I can do this. I feel so terrible. And emotionally, and my teacher told me that's because you're finally giving your body the opportunity to feel your feelings, which is another reason why I think people don't like acupuncture, because you are forced to be vulnerable, laying on the table, allowing somebody to stick needles in you. But then you have to feel your body. Do you know how, like, that's literally all we try to do nowadays is like not feel anything. Scrolling, taking this, taking that. Like, we don't
Disconnect.
want to feel.
Yeah.
And acupuncture is the antithesis of feeling. Like, you have to get into your feeling.
That's why guys.
Which is also why
not a guy thing.
which is why I have a tendency to have a lighter hand, because so many people are like that. Like,
Yeah.
you got to be gentle, because if you just get in there and you start poking and prodding, of course they're not going to. I shouldn't say of course. Some people may be less likely to come back.
Yeah, I mean, I think anybody who walks in the doors probably knows what they're in for, in a way, right? Like,
I'd hope so. I guess
in,
I
like-
don't give people the
in
benefit
like
of
the
the
worst,
doubt.
like you're walking in a door going to if you
Yeah.
have the worst sense of it, you're not walking in, right? Like, if you're just like, I hate needles, there's no way.
Well, I think then
That
that it's
person's not
for
coming.
the experience that they get, because they're going to tell somebody whether it's a good or a bad experience. So
Sure.
if they come in and they know what they're getting into, and it's the opposite of what they thought, or it's better than what they thought, or worse than what they thought, that's where I think the play I
Sure.
try to
Yes,
make.
I like when I went in, I didn't know what to expect, but
Which
I
is
did,
probably why you
I
also had
set
a
like
nice
a reasonable
outcome.
expectation,
Yeah,
right?
yeah.
Like, I was like,
Right.
I've gotten needles before.
Now,
Like,
you guys both talked about like your like experience during it, like what, and I've never done it before. So, what do you tell like new patients like to actually think about and feel? Like you said,
I
that
try not
before.
to dictate.
You don't try to, and you just
I really
say, just
try
be
not
aware
to.
of
I
your
just want
body.
people to feel safe and calm, because if people feel safe and calm,
I mean, you
they're
can tell right
in-
away if somebody's freaking out, right?
Yeah, I've had that happen where, some people,
Like just straight panic mode.
it's not that they go into panic mode. I just think sometimes unfortunately, like, our society has so many mental health issues that like people pull at straws for control. And if they're meeting a stranger, sometimes that's their pull.
That's their pull, yeah.
And like, I am meeting people who are sick or in pain. So like, sometimes I'm not my best self. They're not, like, it's an exchange, So, I don't know if I answered.
Yeah.
No, that's perfect.
Do you
That's
ever
what-
like see somebody and decide like, hey, this probably isn't for you?
Yeah.
Like,
And now that I'm becoming more and more experienced as an acupuncturist, I can say that. Whether it's after the first session or even before, like, hey, I'm going to refer. I learned that being on maternity leave. We were joking
Yeah.
about this before,
There's no
because I
need-
run my own business. I don't really get maternity leave. I just chose not to go to work for 3 months and be
Yes.
home.
You're the HR department.
Right. I'm kind of everything. No, so that's something I guess people can know. It's a one-woman show. So I schedule the appointments, I administer the treatment, I clean the room, So I
like that.
don't
It's a
handle the
personal
insurance.
touch.
That I outsource because I love acupuncture too much, and I think if I knew what the insurance companies were doing,
That's a nightmare.
it's a nightmare. So I do have an assistant who virtually helps me with my
Is it
insurance.
all out of network? Pretty much.
I am an out-of-network provider because I don't want to be dictated by like, oh, your policy only covers this, so we can only do that, or I have to see so many more people to make up for the reimbursements. I mean, thankfully, a lot of my patients actually are just direct pay, and I'm moving, I think, more and more towards that. Because it's just
I mean, a
what
lot
they
of-
get away with is criminal. It's criminal.
I deal with that a lot. Like my wife is a teacher.
Oh, okay,
She's
sure.
So she just decided that she was gonna stay home this year because our kids are just in so much. It's impossible.
Yeah.
It's impossible for us both to do what
I get
we were
it.
doing. So she pulled a short straw and has to stay home now. But
I'm sure she's fine.
so we
with
switched
that.
over to my insurance.
And that's a big, I mean, if she had the
Like,
teacher
going from
policy, yeah.
New Jersey teacher policy to
yeah.
not.
They
New
don't make
Jersey-
those anymore.
They
You
don't
can't
make
even get
those.
that anymore.
Yeah, they
No.
don't even have it for the new.
So like we have 0 out of network coverage
Yeah,
on mine.
same.
So, but like our conversation is just like very simple. Like just go do what you got to do. Like it is what it is.
Exactly.
Like-
and there are times where you're going to use your benefits and you're going to meet great physicians, and that's awesome. And then there are times where you need to go get a mole looked at, and the dermatologist who takes no insurance will see you tomorrow, and you have to wait 6 months to see
Yeah.
the other. So you just make the decision based on what's right for you.
I mean, funny to say, like my wife's dermatologist, skin doctor. She just had like going through some like melanoma, and like we've been kind of battling some of that. So she's on the good side of it now, and everything
Great.
went great. But like her doctor that's been caring for her through this whole process is now out of network. But like you're not switching,
Right.
Like it
Right.
is right. Like we trust him. He's
Right.
awesome.
Totally.
That's who you go see.
Yeah.
And I think that's what everybody's like mentality is starting to come around to, because a lot of doctors are opting to go out of network now because the insurance is such a disaster.
I just think but the insurance companies aren't catching up. Like why? As a provider, my insurance reimbursements every year go down. And now what they do is they hired this third party to reprice. So you or me, we all pay for insurance and we're supposed to get coverage. 80%. Let's just say you have acupuncture coverage. You're supposed to get 80% covered of your visit. It's like, well, we actually think we should pay you $17. How do you feel about that? So you're reducing our rates as providers. We're trying to help people,
And they
but
dictate
we
that.
have to pay more every year.
Yeah,
Wait,
like
they dictate each year. They change the
Reimbursements, and it goes lower and lower.
I mean,
And that's out of network. I can't even imagine what in network is. But then as a provider, you think to have access to more people, do I need to now go in network? So what are you sacrificing the care you're giving to give care to more people?
I mean, I
That
can
is
tell
all
you
bounds.
that
Acupuncture is okay because it's like it's medical, but like a lot of it's not seen as the expectation isn't there to have it be
Right.
covered yet.
I will say, like, anytime we try to, especially around here, we have Blue Cross. Anytime we try to go like in network, I mean,
You're still
it's like,
paying,
none of that, and they'll be like, oh yeah, you could get an appointment next month.
right?
We'll see you in 2 months. Like,
But every year we have to pay more and more for coverage.
insane.
So I don't know how, but they've figured it out. They have totally
They've figured it out how to get us
and
to get you.
we're all suckers.
yeah, but I think ultimately we'll see.
I hope so.
We'll see some progress.
Maybe
there.
our
like,
kids.
Our kids will, not us, but our kids
Maybe
will.
our kids. I actually had to bring Gio to work with me the other
Yeah,
day.
so that's what I was going to ask you. How is it? Being your husband works, you got 2 little kids. Like you're in the thick of it right now.
Yes.
How is that?
I
like,
only work
running
2
your own
days a week.
business? Yeah.
I shouldn't say that. 3. I work in my office 2 days a week, and I work the Jets 1 day a week for a half day. And when I'm at my office, I probably cram a week's worth of patients into 2 days.
Yeah.
But I like to work like that. I'm very, fast paced, always moving. I don't know what a break is. Clearly, I do everything, right? So,
Yeah.
I'm just the type of person who, what is that called? ADD, maybe? I don't know.
That's what we all have
But
these days.
that's why I do that, because I want to be home with my I want to be home with my kids. Like I love acupuncture so much, but that was also before I knew what a mom was like. I mean,
Yeah.
that's like
Now
the
you-
ultimate for me.
As a mom, like I know you know a lot, very educated in like the health and wellness field. Like, how do you feel about like the food that you're feeding your kids these days? I don't want to get you.
We should call it
such-
food.
Well, that's why I said
High quotes.
food.
We should call it food.
Yeah.
Hate to laugh about that, but
So I grew up, full disclosure, in like a family that had a lot of food rules, and I see what the impact of food rules has had on me. So in terms of like the food rules, like, oh, food is bad, or oh, food is this, like we try not to like use those words necessarily, but we also, my husband and I, so my husband's a personal trainer, owns his own gym. He's in great shape. We've both always been into health and wellness. I grew up with health and wellness. So like we don't have that stuff really in abundance in our home because we don't eat that way. But like on Sunday, did Mike take Gio to McDonald's?
Yeah.
He did, and do I love that? No, but it's an occasion, and we don't make it a big deal, because if you do, those implications for me actually I feel like because I can't solve the way food is produced. I can wash my vegetables, I can buy organic, those are the things that I do. Some people don't feel like that's necessary, but I do that. We don't really have food dye in the house because I don't need that stuff,
Right.
But because I can't change those things, we might as well just make it like my 3-year-old the other day, he was eating something and he turns to me, he goes, "Mom, my tummy says I'm full." I feel like that was a parent
happened.
win.
Yes.
Never
Because
happened.
can you teach me what that means?
What
Because
that
like
means.
in my brain, there's always room for dessert, or there's always room
Yes,
for more. But
that's
to
like-
have a 3-year-old, like, I don't know, at least verbalize the concept of what a hunger and fullness cue is. And it's not just about the hunger and fullness. It's about understanding like that's enough.
Yeah.
Our society is like, there's never enough. Money,
It's never enough. Yes.
it's just never enough. So to understand like this is
overindulgence.
enough,
Yeah.
I'll take it.
My
good mom, good mom.
my older daughter's a very good eater. She'll
Right.
she's an expensive eater.
Yeah, yeah,
she
yeah,
likes food.
Yeah,
Like
yeah.
You give her chicken nuggets, she'll have a couple of them. She's like
That's good.
over it, but like you put out a dozen oysters and she'll
Oh my God,
rock
I
'em.
love that.
Yeah.
Which one? The 5-year-old or the
7.
7-year-old?
Yeah.
See, I have that 3-year-old who's still like, "What do you want for lunch today?" "Dino nuggets." It's not Wednesday. We have
Right.
Dino nuggets on Wednesday. So like again, I'm still
There is
introducing it to him, but it's
there-
not like
Well, my kids literally eat, like when we have steak, we do New York
Oh,
strip
yeah.
or dry aged rib. Like I didn't even know what New York strip was till I was like 25. London broil was steak. to me. Like, that's all.
right.
My kids eat whatever we cook. So
Well, that's just it,
We
too.
cook at
Right.
home.
Yeah,
That's
same.
what they're getting to eat.
Same.
Like, and I grew up like that, right?
Exactly.
And my mom's Italian, my dad's Spanish. Like we literally we're just always ate at home. Like we went out once in a while, but it was like a thing, right?
Right.
So we eat a lot at home. But like the other night, there's a Taco Bell that just opened up in town. Like
Yes.
literally the day we.
Oh, so do you
like,
still
You got
live
a
in
Taco Bell?
Millington?
I live in Basking Ridge now.
Okay, yeah.
So-
We haven't hit up Taco Bell yet.
The
I'm
day it
sure we
opened,
will.
it- like-
new one.
No, like it literally just opened.
Yes,
we were there
we've
the
all
day
been
it
watching
opened.
it.
Yeah, we've been watching it. So like my daughter was like every day was like, when do you think Taco Bell's gonna open? When do you think Taco
Right,
Bell's? Because their
right.
dance studio's like right next door to it, so
Right.
they were always passing it. So the day it opened, I was like, we're doing Taco Bell tonight.
Yeah. I think it must have been a working day, or else my husband would have totally been
it was
there
like
with.
it was
yeah.
Wednesday. Like, by the way, it was
But it's an
amazingly
event,
terrible.
and it's an experience, and it's a one-off, and it's a no
Yes.
big deal.
It had to be 20 years though since I've had Taco
Oh,
Bell.
I can't remember tell you
It was
last
so
time.
good.
I actually tried to go into the drive-through. Probably shouldn't be, but like went into the drive-through, it was closed, and the guy's like, "You got to be in a car," and I'm like, "I am in a car." Can't you see? Because I wanted to talk about that. I tried to get it, I couldn't get it.
Yeah, no.
But, yeah, they
so
did.
every once in a while, you need to have a cheat day.
Yeah,
I think
right.
there's
We
nothing
do
you can
that.
do
I do
about
that.
it.
You do
but,
that. Right, exactly,
like,
you know?
we're busy. We don't have a choice sometimes.
Right.
But yeah, it's even like sometimes the school lunches for
Yeah. See,
like,
I'm not there yet.
You're not there yet. When you get there,
Oh,
it's,
they're gonna want. What am I gonna say? Like, what am I gonna
super
do?
concerning because like my girls can go up. Like if they're like, hey, we want to buy lunch today. So they have like a hot lunch, they have a cold lunch, and they have like a couple other options, and then every day they have pizza.
Of course.
Right?
And what is your
So like, what are the kids
Right,
going to choose?
right.
Seriously, like they're.
Right.
My little one she's in kindergarten, so now she gets to buy lunch, and even if we send lunch,
they're not gonna eat it.
they don't need.
Are you kidding?
They know that they have to go swipe the card.
I know.
They have like this little card that has money on it.
I see
Apparently,
mommy swipe this thing.
That's
all the
why
time.
again,
Yeah.
like I was
They're definitely swiping.
Yeah,
we
they
are
figured it
fighting
out
an
quick.
uphill battle with food because of the way it is manufactured. With the flavors, the not natural flavor profiles are literally so excitatory for our brains.
Yeah.
We are addicted to it.
oh yeah, it's like just straight dopamine.
It really is.
Yeah.
And so I think that at least my way of approaching it is that they're gonna want it left. If you are left, this is parenting, right? If you are left to your own devices to make a decision, just make
Yeah.
the best one that you can. And some
100%.
days it's going to be pizza, but maybe every once in a while my kid will pick chicken and sweet potatoes because that's what we eat.
Right.
Like, or he sees daddy eating or mommy eating it, or like he'll have a piece of, he'll know like, okay, I'm going to have pizza, but I'm going to grab a banana and get a little bit of fiber. Not because
Right.
he understands that, like, but it's just what he's used to.
Our kids are like, we also like try to, when we're working out, like they always see us.
Oh,
Like, we're
yeah,
not, like,
same.
You know, they'll do if
But
we
I
work out
worry
at
about
home
that
or,
sometimes. I do, because like, I mean, since the older one was an infant, we have a little gym. There's a gym in our house, right? Because when you've got little kids, sometimes
Yeah,
that's
yeah,
all
you
you
have no
can do
choice.
is get to the gym downstairs. So he's seen me on the treadmill a lot
yeah.
in his first 3.5 years of life, and I'm hoping that I'm only sending positive messages.
I think that's a very good message.
I mean, I
though.
don't like,
can tell you
there's
this.
no mirror, so I'm not like checking myself out in the mirror, like body shape. Like there's none of that. I'm very cognizant of like positive talk, but
we're very positive about it as well, but I would think that them seeing that in any capacity, at any amount, is better than seeing you slouched up on the couch in depression mode every day.
Right,
Like
yeah.
you
Oh, you want to hear the other thing? Sorry to interrupt
No,
you,
go
but
ahead.
speaking of this,
Yeah.
so I've taught my 3-year-old to tell me that my phone is not important. Because again, he's going to have YouTube. He already knows how to use YouTube. And YouTube has somehow figured out how to show my son who loves Spider-Man videos of Spider-Man getting decapitated
I
because
have to hide.
I took it off my phone.
Yeah,
I took it off my phone because I couldn't get that off my algorithm. So the solution was taken off my phone.
I
So
can
again,
understand that.
like, so I tell him, I say to him, because if I'm on my phone and he's sitting next to me, I'm like, you know what, Gio, my phone is not important. So now if I'm on my phone, that's my son's name, Gio. He'll say, Mom, your phone is not important. So again, like if his brain could at some point put
Associate.
together that what's on here is not important, because like, is it really?
I'm bad with that. Like I'm bad with my
Debatable.
phone because I'm.
I have to have those app
your job
limits.
is,
Somebody
like,
told me about that,
My
like in
work
September.
life is.
I know.
Is
What?
like there.
App limits. So
Oh,
you
app
can
limits.
set limits for your apps
I saw
every
one the
day.
other day. You have to do like push-ups to turn apps on.
That's a good one. I like that
Saw
one.
that.
Oh,
There's,
okay.
There's an app
Maybe
there.
that, yeah. No,
Try
this
that
is just
one.
like within
Yeah.
your phone. You
I
can
can see
say,
that. Yeah, you can set
like,
that.
I only allow myself, except for Fridays, because that's content day, 30 minutes a day between all of my social media apps.
That's a good thing.
And I try
I
to
hit that
uphold
thing and I
it.
just hit
I
ignore.
really do.
Like 2:00 in the morning, and you're just in the death scroll.
But you know what I say? So since doing this app thing, if I do wake up at 2 a.m., I'm like, wow, grabbing my phone is not going to put me back to sleep. And
Yeah.
so I choose not to.
Yeah.
I mean, sometimes I,
Yeah.
don't, from whatever reason, need that dopamine hit at
The-
2 o'clock in the morning, but it's
phone,
helped.
The phone is my biggest. Like I try to be very conscious about it. Like if I catch myself, I'll
Right.
like put it down, or like I've gotten phone shamed a couple times by my girls. They'll be like, "Dad, put your phone down."
But
Like,
it's
you
not
know?
our fault because as millennials, technically, right? You're like a
Well, you guys are
right
millennials.
millennials.
I
So let's
think
just
I'm
say,
out of
as
it.
We're on
millennials,
the
like
cusp.
we
You
were
are
I'm out.
like given this technology, and it's like, here's some crack, have fun.
Yeah.
Like we were not given any boundaries as this technology was
Nothing.
developing, which is why we're so addicted to our phones because, or just that life
I'm completely
in general.
addicted. Like,
Yeah,
I
because
Completely, you have
it's
to. Yeah.
I'm gonna play that card. It's not our fault.
But some of the
It's
kids
not
in
our
high
fault.
school these days, like legitimately, will start shaking if you don't have their phone for an
Well,
hour.
that's what I think I
Like, that's-
learned. I don't know. I think being a parent has been I take it very seriously. I really take
Yeah, I could tell you take
parenting
parenting
very-
a lot more seriously.
I
than
dad
you
really.
seriously.
I do dad hard.
do that hard.
Yeah, I dad hard.
I'm not. It's not a strict thing, but I
No,
just
no.
like
in
That's
terms
good.
of like,
I think because of I have a great upbringing, great parents, great family, but like I see generational trauma, the things that I deal with because I know my genetic profile and I know that the genes pull the trigger. And so it's like, okay, if I have an opportunity to really be such an integral part of the nurture and the nature, like that's amazing. That's what it's about.
I mean, I see my wife and myself and my kids all the time. I'm like, I'll be like, Jen, that was you. That like I just saw you in this. Right?
Oh,
Or like,
rude awakening.
she'll be like, that's your daughter, and I'm like, well, I'll take. Let's put
I
her,
get
put her
that
clothes
comment
back
a
on.
lot.
Right,
Take her off the
she
table.
is. But she is. But that's what it is. Like they and I think why I'm so cognizant of is I see my children watching everything.
Yeah.
Like repeating what I say. And I also know like I have some of my best and some of my worst qualities from my parents. So like why not just emphasize like the good things that you can do as a parent?
Yeah.
Not good, but
Your kids are
positive.
still a little young.
I know. I know.
They get to a point
know.
where they get these outside influences.
I'm going to homeschool. No.
They start like the outside influences.
I know.
Get insane very quick.
Well, the school
Insane.
stuff-
Insane. Which
the
is
school
why
is a
I
big
just
one.
want to start with the foundation.
Yeah,
Young.
you have to
Because I understand that when they go out into the world,
You can't control
I
it.
can't control anything.
Yeah.
All I control is what goes on at home.
Yeah,
Which right
Well,
now
at one
is
point,
so
once they get old
important.
enough, you just have to say, listen, they got to make good decisions.
No, and that's what you lay the foundation for.
Yeah.
That's what morals are. That's what that's all about.
Yeah, and a little bit of fear.
Well, a lot of fear.
Agreed. We're like gentle-ish parents.
So I had a
Yeah.
wrestling room in my basement. So like when Dyfus comes, I'm just like, oh, we're just drilling.
Yeah, exactly. We do jujitsu, so we have the same
Yeah.
purpose.
Jiu-jitsu.
Yes,
We
exactly.
like having two girls.
God bless you.
It's hard.
Yeah.
Like because you can't I'll crush them, right? So like you're just having these conversations and
Yeah.
they're looking at you and they're basically telling you go fuck yourself, right? And
Yeah.
and I'm just like, do you understand?
Right. Right.
The most I can do is take you from this doorway and throw you to your bed and lock this door.
Right.
And you need to have like a little bit of fear that dad
little bit.
is
Just a
My
little
fear
bit.
for my 15-year-old daughter is the best thing Verizon ever did. It's a smart family, and at the push of a button, boom, her phone is
Great.
rendered
But if
useless.
that's what you
Really?
need,
So that's her
then that's
fear.
what you need.
That's my only.
That's
what else am I
fine.
gonna do? What am I gonna hit her?
Yeah,
Like, I can't hit her. I can yell in her face. She literally looks at me like,
Oh,
that.
my 7-year-old could care less. Like I literally.
Yeah, that'll
just
be my
zero.
second.
My second one is borderline murderer. Like she's the one that I have to to worry about. She's gonna be like rolling the keg down the street. I'd be fighting my whole life to keep her off the pole.
Yeah.
Like there's a lot that's gonna have to go into number
I
two.
see that with my second. You've
I
just
only
two,
have two,
right? I
yeah.
know. That's
No.
why like I get such second vibes from my my second. So I'm like,
Yeah.
maybe we'll have a third, and then I'm like
a middle
ugh.
child, so
Okay.
I can relate heavily
You
to
can.
the second.
See, my husband's a middle child,
I'm a middle
and he's
child,
like
too.
he should have been the oldest.
Yeah, so I'm a hard middle. Like if you had
So you can sympathize.
yes, I completely sympathize, but my older one just like has all the attitude in the world. Like wakes up mad.
Yeah.
Like,
Yeah.
Just the whole thing. And I'm
Yeah.
like, you're 7. We need to
Yeah.
figure this out.
Exactly. Yes. Oh man,
stuff.
I know, and I know my kids are little, so like I'm only talking from the experience
Oh,
of
you'll-
having them, but I understand like
It starts
that's
there,
coming.
and you're doing everything you
So,
can.
that's all.
There's just a certain point
Yeah.
where Jesus takes
and I
the
know
wheel.
one of the big things she does. She was telling me that she does family dinner every night, which I know that you got to get out of here soon.
I
for.
do. I'm
She does
probably
family
have a
dinner
couple
every night.
volatile texts waiting for me when I look at my phone. Yeah. So again, I know my children are little, and at some point they're gonna have sports, and this is not gonna be attainable. But we eat dinner together every night.
That's awesome.
Mike sacrifices clients. I sacrifice patience. opportunities. I mean, we go out every once in
Yeah.
a while, but yeah, family dinner.
Well, I will let you get to your family dinner. This was amazing.
Thank you so
was
much for
great.
coming.
Thank
Time
you
flies.
so much. Yeah,
We'll
this was
definitely do
great.
this
We
again.
could do more. Yeah.
Yeah, we'll have to throw some needles in Gabe next time. Watch him sweat a little, but we'll figure it out.
Thank
So,
you so much.
Doctor, thank you for
welcome.
coming.
Thank you so
We
My
really
pleasure.
appreciate it.
This
This
is
was
great.
awesome.
Thank you.
Thanks.
Awesome.